Hi friends, welcome to classes by Lab Doctor. I'm Dr. Divya and let us today start with the kidney function test or the renal function test. So this is the test which is very commonly done in any of the laboratories and gives us lots of valuable information regarding the functioning of the kidneys. So in the kidney panel, the KFT serum or the RFT, renal function test, KFT, RFT, all these are same. So what all things do we have? We have the creatinine and we have the GFR also sometimes in the report. Sometimes you get the kidney function test report as extended, basic panel etc. in the laboratory. So कभी कभी जब extended panel रहता है तो वो लोग GFR भी इसमें include करते हैं. GFR is nothing but glomerular filtration rate. यूरिया कितना है, blood urea nitrogen and 1 to creatinine ratio, uric acid, total protein, albumin, Ag ratio, globulin, calcium, phosphorus, sodium, potassium, chloride. So these are the few of the parameters which are covered in the kidney panel or the KFT. We will discuss about each of these parameters. Few of these parameters are already discussed in the liver function test also, but we will brush up on these parameters also in these series of videos which will be covered under the broad heading of kidney function test. But before discussing about the functions of the kidney, let us first understand the anatomy and physiology of the kidney, which will help us to better understand the functions of the kidney. So you have two kidneys in the human body and these are bean shaped structure. Both side of the vertebra में रहते हैं ये and एक किडनी का जो वेट है ऑलमोस्ट 150 ग्राम रहता है. इट मेजर्स अराउंड 10 to 13 सेंटीमीटर्स लॉन्ग एंड विड्थ जो है इट विल बी अराउंड 5 to 7.58 सेंटीमीटर्स एंड अराउंड 2 to 3 सेंटीमीटर्स थिकनेस रहता है. And it is almost a size of the fist. So these kidneys अगर आप उसको कट ओपन करोगे तो स्ट्रक्चरल एंड उसका फंक्शनल यूनिट जो है दैट इज नेफ्रॉन. सो ऑल द वर्क्स इज डन बाय दिस नेफ्रॉन. सो दिस नेफ्रॉन कंसिस्ट ऑफ व्हाट? अगर मैं जब व्हेन आई से नेफ्रॉन इट कंसिस्ट ऑफ दिस ग्लोमेरुलस. So it consists of this glomerulus, it consists of this proximal tubule here, this is the loop of Henle, this is the distal tubule and this is the collecting duct. So this nephron is a functional unit of the kidney and there are millions of nephrons in the kidneys. So when we say this nephron, this is the glomerulus which filters the solutes from the blood. So ये जो filtering unit है, this is the glomerulus. Then comes this proximal convoluted tubule. Proximal is this part which is close to this glomerulus, so that is why proximal convoluted tubules. So it mainly reabsorbs the iron, water, nutrients, removes the toxins, adjusts the pH, etc. Then you have the descending loop of Henle. So this is the descending loop of Henle. This is the loop of Henle. This is the ascending loop. And this is the descending loop of Henle. So this descending loop of Henle, it has this aquaporins, allows water to pass from the filtrate into the interstitial fluid. This is the ascending loop of Henle. It reabsorbs the sodium and chloride from the filtrate into the interstitial fluid. This comes the distal convoluted tubule. So ये यहाँ पे it selectively secretes and absorbs different ions to maintain the pH, electrolyte balance, etc. These are the collecting ducts. They reabsorb the solute from the water and the filtrate. So this is the unit or the functional unit of the kidney, the nephron. What are the functions of the kidney? So first thing is it helps in the regulations of ions in the blood, that is sodium, potassium, chloride, phosphates, etc. It helps in the regulation of the blood volume. It also helps in the regulation of the blood pH. So it regulates the pH by excreting variable amount of this H plus ions in the urine. It conserves the bicarbonates ion. And there are few hormones which are produced in the kidney, like erythropoietin, which helps in the production of the RBCs, calcitrol, which helps in the calcium homeostasis, and yes, excretion of the waste. So it helps to remove the waste products from the body in the form of urine. It could be ammonia, urea, creatinine, drugs, etc. I have told you that the kidney nephron has various parts. So the proximal tubules which I was telling you, these are the proximal tubules which are metabolically active. So they will filter so many products here. They will filtrate sodium, potassium, H plus ion, phosphates, etc. They will reabsorb the sodium, chloride, water. They will eliminate the drugs. They will eliminate the water. They will eliminate the H plus ion. They will retain few of the plasma protein, blood cells, and they will secrete the H plus ion and ammonia. Similarly, the distal convoluted tubule. So here the distal convoluted tubule, it also reabsorbs few things like sodium, chloride, water and bicarbonates, whereas it secretes H plus ion, creatinine, drugs, toxins, etc. Then you have the loop of Henle. The loop of Henle, it mainly reabsorbs. So it reabsorbs the sodium, chloride, water. Selectively it is permeable to sodium, water and urea. The collecting duct, this also reabsorbs as well as secretes. It secretes the H plus ions and K plus ion and reabsorbs sodium variably, bicarbonate, water, potassium, H plus and ammonia. So now when we have to classify the kidney function test, we classify it into 4 different categories. One is the test for assessment of the glomerular function. So the glomerulus, what is there? To assess its function, we have few tests. It could be blood urea, uric acid, creatinine, proteinuria, hematuria, renal clearance test. All these will measure the glomerular function. So to assess the function of the glomerulus, we perform these tests. Now, how do we assess the tubular function? So we assess the tubular function by the urine concentration test, by the urine dilution test, by assessing the tubular proteinuria, amino aciduria, glycosuria, presence of the reducing substance. Then you have the acid load test. So these will assess the tubular function. Then you have the urine analysis, which also will assess the filtering capacity or the capacity of the kidney to remove the waste. So in urine examination, we have physical examination, chemical examination, microscopic examination. We have dealt with urine analysis through a complete video series wherein we have concentrated on each of the parameters. You can refer to those series on urine analysis also. And there are tests to assess the renal plasma flow also. So these are the classification of the kidney function test. So to assess the glomerular function, to assess the tubular function, urine analysis as such, and to assess the renal plasma flow. In addition, renal biopsy is performed sometimes to confirm the diagnosis of the renal disease. So all this will come under kidney function test. So what are the uses of this kidney function test? As the name suggests, it helps us to assess the function of the kidney. We will come to know whether our kidney is functioning normally or not. It helps us to define the nature of the disease. We will also come to know how much the kidney is damaged. We will come to know the degree of renal dysfunction. If at all a renal disease is progressing and the parameters are worsening, we know that the disease is progressing. To assess that, suppose if the patient is put on a treatment, to assess the response of the treatment, and when we want to adjust the dose of renal toxic drugs, etc., which are mainly excreted by the kidney, we take the help of kidney function tests. So the choice of kidney function test. Now I've told you there are tests for the glomerular function, for the tubular function, the urine analysis, and for the renal blood flow tests, etc. So how do we choose which test is the best test? So the assessment of the kidney function will start with the routine test like the routine urine examination followed by the kidney function test. So once the patient comes, we directly don't order for creatinine clearance or something like that. We order for the basic tests, simple urine examination, a kidney function test that will give us a majority of the time an idea whether a patient could be having any kind of a kidney disease, and based on that the final specific tests will be done to assess the glomerular function or the tubular function or the renal blood flow like clearance tests, etc. Also note that two-thirds of the tissues must be functionally damaged to show an abnormality in the test. So remember, when we see the report, it is just not the reports which we are supposed to interpret. We are supposed to take into consideration the patient's condition, the patient's symptom, associated other findings, etc. Because when the kidney function test, just because if it appears normal on the report, that doesn't mean that patient does not have any loss or any disorders with the kidney. So kidney must be significantly damaged to show certain changes in the reports also. So sometimes you might get a normal report and you might think that yes, the kidney is absolutely normal. It doesn't work like that. More than two-thirds of the kidney, when it is not functioning, then only we will be seeing majority of these changes in the blood as well as the urine parameters. So that is all about the introduction to the kidney function tests, and we will discuss about each of these parameters in the coming classes. Thank you so much for watching the video. Please like, share and subscribe the channel. Thank you.